Isn't there a MEDEX theme song that needs to be written?
Yeah, MEDEX theme song. My name is Forest Hofer, and I work at Skyline Emergency Room in White Salmon, Washington. Join MEDEX. Want to be a PA?
He had shoulder-length, blonde, curly hair, and he was very brash, and he was also very funny.
I have the privilege of saying that I was Forest Hofer's first PA student.
I was a very fortunate guy. I was fairly young. I was 26 years old when I got into MEDEX. I was a registered nurse. I had done emergency nursing, and prior to becoming a registered nurse, I had been an emergency medical technician. That was kind of a dead end for me, so I decided I'd go to nursing school. It seemed like a better opportunity. And so that's what I did, and I did cardiac surgical nursing, and I did intensive care, and I did coronary care, and I did emergency room work. And then I went to MEDEX. I was in class 14. That was an epiphany for me, because it was the first time that anyone had said, you're going to be making decisions, so you have to learn how to make those decisions and decide what you're going to do in a given circumstance. And it mattered what we thought. It mattered what we were learning and what we were doing. And we were being taught a sense of accountability and a sense of responsibility, and in a way that was not taught in anything that I had done previously.
In the beginning parts of your MEDEX training, you have these groups where you talk about, what you did before and how to transition to the kind of provider that we want MEDEX to be. So people were talking about all the different kinds of jobs that they had done and how they really wanted closer contact with their patients and, the continuity and to get to know them better. And Forrest said, well, as an ER nurse, I've had too much close contact with patients, and I'm actually looking to be a little less close to them. I mean, he said it in this way that was funny, but it was also really serious. It was sort of the first time that I kind of saw the seriousness of Forrest in terms of reflection, reflection on what his experience had been and where he wanted to go with it.
That was a very empowering thing. I really appreciated that. Changed my perspective on medicine entirely.
It all began on a road trip to Hood River, Oregon in the middle of my didactic year, when my husband and I drove through White Salmon, Washington and discovered Skyline Hospital on the ridge overlooking the Columbia River.
My first MEDEX student was someone who found me.
Because our clinical coordinator had suggested to us all to pursue our own preceptors, my husband and I stopped to check the place out. Although Forrest was not working that day, I met a few friendly people and somehow left with his phone number.
I'm not even sure how she did.
And the information that he worked 24-hour shifts in the ER and that it was okay for me to call him. I called and left a message on Forrest's voicemail, fully anticipating a gracious decline. To my surprise, however, he called me back and said, sure.
I think she set the tone for everybody else afterwards. It was such a good experience.
How was I to know that he would say yes and not only give me a very valuable experience in the emergency room, but also become my friend?
She got a lot out of it, and I got a lot out of it. It was my first step in what they taught me at MEDEX was the payback. Hi, Ben. I'm Forrest. I'm working with Carrie here. I'm our preceptor here. When you're starting out, you're really concentrating on just becoming competent and getting your own power and trying to find a decent wage and a job that you can live with. Wrap around his wrist to the other side. And then you have power years where you're providing and you're maximizing your abilities and maximizing your practice time and your income. You can't kind of lean on it. It pushes the water through it. And then you have a time in your life where you can see that there's going to be an end eventually, that it's going to start to wind down. And what do you really want to do? Well, you want to sort of pass on, maybe some of the insights and some of the benefits that you've received over those years. And that's when you start thinking about taking students, and giving back.
Ligaments in the thumb.
And it's sort of that watch one, do one, teach one, only translated over a life's experience. And I think that taking students was that for me. You have an agreement with them about what their pain management is going to be, right?
The things that Forrest brought to me that I hadn't previously experienced was that level of integrity.
Students say, well, you might think that if you have this and this condition, you might want to offer this top of the line medication, but not if you're with Forrest. If you're with Forrest, you know what things cost, and you know what is the most cost-effective treatment and what's going to work without bankrupting the patient or the clinic.
Forrest could take somebody that was coming in to ask for something specifically from the ER, whether they were using the ER too much, whether they were using it for pain relief, whether they were using it for things that were maybe unnecessary or maybe not. He could speak right to the person with such concern and yet be firm. I totally admired that quality in him.
He has done this amazing thing in White Salmon of being the community provider and mentoring so many of our students and teaching them this is what's essential. This is essential medicine. It's one of the things that I think Forrest has given to us is really being true to the MEDEX mission of how to be a good clinician, no frills needed.
He's a force. Yeah, he's a force.
Some people really stay in touch with their former students, but I don't think there's anyone that comes to all of the MEDEX graduations and events like he does.
When I was in school, one of the things that MEDEX said was, no matter what you think you're paying for this, right, most of what you're getting from this comes from something that somebody else is giving you. They're giving you their time, they're giving you the cost of the school, the cost of the education. He says, you owe something for what you're going to get here.
He puts a lot of himself and his energy into making sure that people succeed. And I think some of that comes from the fact that Forrest is truly a self-made man. I mean, Forrest has been an orderly, he's been an RN, he's been a hospital administrator, and he chose to be a PA. Given other possibilities, he chose to be a PA, and I think that speaks to how much he likes his job and how highly he regards the profession.
You've been given kind of a special place in the social order. You are what in older times would have been called, you are now part of the gentry. You are definitely a person of social position and respect. If I'd taken one student and had them for a year, I would go to their graduation. Right, and I'd be that one student. But I get 12 or 14 students, so I go back and there's a bunch of them there. And seeing them all and seeing them so happy to be finished with their school, to see them glow like that, right? It's just like, why wouldn't I want to see that?
And I think it's really wonderful.
It's a beautiful instrument. I've been an amateur musician my whole life, and this is a handmade uiri, and had fantasies of retiring and doing nothing but playing guitar with my friends. Many of whom are professional musicians and tolerate my tolerate my fantasies. The world is better off, and me too, because I can't sing. Because if I could sing, I would have been a musician. And everybody would have suffered, including me. Everybody has their thing that they try to stay in shape for, and something to give them motivation. For me, it was powerlifting and weightlifting. And at one time, I actually owned my own gym. I owned my own facility for a couple of years. So I've done some powerlifting, and I was pretty successful with the powerlifting for a while. And my grandson is really impressed with all of the trophies that I have. Yeah.
You're a record holder, right?
Yeah, I'm a multiple record holder. But there's a lot of records by a lot of different people, and I'm my own little subcategory, but I still have a world record for my age and weight in the bench press. So I got your world championship trophy in my garage. If you want to know what we're really proud of around here, then you can see the dogs. All right. Follow me. Close that door behind you. When I think about what I'm trying to do and what I'm trying to give back, this is sterling. I don't think that it's any different than what other people have given me. This is grace, but strength, and the evidence of how PAs are taught by other physicians and other PAs who are interested in giving them their time and their insight. Above me is Aldrich Butte, and then past that is Table Mountain. It's not just PAs, it's PAs and physicians and patients, and the time that they spend teaching you and helping you become competent and become a better provider. All of them, right? All of them. The group of physicians who hired me here 23 years ago, embraced me in a way that I'll be forever grateful for. And I think that physicians in general and PAs as well, because I see them as part of the same group, show that kind of patience and tolerance and giving kind of sharing sort of attitude towards teaching in a way that I just don't know of any other profession that does it quite that way.